Dialysis is the artificial process of eliminating waste and unwanted water from the blood. The kidneys do this naturally, but in the case of a failed or damaged kidney, dialysis is required. Locally, dialysis is costly. On average, a session costs thousands of dollars, and in most cases, roughly 3 sessions are required weekly if a person is to continue living.
There are some physicians who were of the opinion that Guyana cannot sustain the dialysis let's say process here because it's too expensive. But if the patient don't have the dialysis, they will die. There's no doubt about it, unless they get that kidney transplant. But it's very expensive and it costs the government quite a large sum of money.
Public Health Minister Dr. George Norton. At the Georgetown Public Hospital, long-term dialysis isn't offered, only a specified amount of sessions.
We only provide for persons who are in crisis. In other words, we take them out of the crisis and we discharge them, and then they can now go to any of the 5 centers that are available.
But Minister, what if the person doesn't have the money to do so?
That is where the government comes in and pay that money for them.
Is that a sustained something?
It is sustainable.
For how long?
We give them, I think, 40 sessions to start with.
And after that, they've got to come up with means to continue, or unless surgery is...
That's right. The urinal transplant is always in the process of doing so.
If the health minister is correct, there could be long-term support for those who are suffering and need dialysis in the future.
We're hoping to do so. We're hoping that we can extend the services to have more than the couple of chairs that we have. As a matter of fact, we have been promised, and I'm disappointed that it's not really in function, but we should have had at least 20 chairs available here to the public at the Georgetown Public Hospital. And we would have been able to do much more than we're doing at the moment.
Although dialysis helps patients whose kidneys have failed, it is not as efficient as a normal kidney. Kidney disease usually results from diabetes, jaundice, inflammation of the kidney, high blood pressure, among others. Handel Duncan, HGP Nightly News.